First off, thanks everybody for joining us today. We have an exciting topic. It's kind of my favorite topic of all time, is around data privacy, data ethics. And we're focusing on this specifically in the time of coronavirus. It's a series we started a couple weeks ago where we wanted to try to take tech salons, which are normally in-person events. We wanted to see how we could move them to an online space and still keep up as much of the quality as possible from a face-to-face interaction. So we've been doing tech salons for about 10 years in different places around the world: DC, New York City, San Francisco, Bangkok, London, Helsinki, Lusaka. We have some folks here today that have been working on other city salons, which is great. We're really focused at bringing together the tech sector and the development and humanitarian and aid sector to try to figure out how we can do a better job working together and kind of take advantage of the skills that each sector has, and also take advantage of all the people who are kind of right at the center who work on both of those areas. So the salon idea is really an informal conversation. If you want to have breakfast or lunch, or I think people in the UK might be ready for happy hour, so feel free to just be comfortable, be yourselves on the call. So I wanted to just introduce the organizers. You've heard Andy. Andy's been doing a lot of the back end stuff, and then we have Joy and Alana and Ali and I who've also been organizing this series. These are the folks who are currently supporting this series of salons. We have Dial and the Principles for Digital Development, Pivotal Act, ThoughtWorks, GitHub, and the Engine Room. Big thanks to all these folks for helping us put these on, because it's actually just as much work to do an online event as it is to do an offline event, it seems. So lots of time and effort put in. So thanks to everybody there. The first event we did was really a big picture event around the tech sector overall and what the kinds of responses might be from the tech sector in response to COVID. And then last week, Lizzie led a really great salon with some speakers from Uganda, Pakistan, and Ghana, talking about what life was like, within organizations, local organizations that are preparing and getting ready for COVID in their environments and their contexts. Today, as I mentioned, we're going to talk about data ethics and privacy. Next salon on May 14th is going to be around how to best volunteer your tech skills during the COVID crisis. And then we're looking at a last salon probably around the end of May that's going to be around what the corporate and foundation response could be to the COVID crisis. After that, we're thinking about doing some that would be focused on monitoring and evaluation and how to do that type of work remotely, because people can't be in face-to-face contact with each other anymore. This is our topic today, and this first part of the salon is being recorded, and then we will post that along with a report on the Tech Salon website so that folks who couldn't be here today can watch the recording. If you want to tweet and share about this first part, that's absolutely fine. You can use either of those hashtags. But then for the second hour, we're going to go into moderated off-the-record discussions because we're, again, trying to replicate this idea of these more informal discussions. We have so many people here today that have amazing amounts of expertise on this topic, and we want to make sure that those folks also get a chance to kind of chat with each other and meet each other here at the salon. So that part of the salon is off the record. It's not going to be recorded. We will shut off capacity to record so that it's really, really off the record. We would just ask that you don't share out what happens in that second part. You can talk about what you learned, but don't attribute names or organizations without permission. Our general rules of engagement at salons are really, again, just to get people together, to share challenges and learning. We ask that you bring yourself, bring your open mind. This isn't a space for pitching. If you have a great project that you're trying to get funding for, that's awesome, but this isn't the place to talk about it and to pitch it. This is really a space for learning. We also ask for speakers as well as participants to try to limit the use of acronyms, because we have people here across various sectors, and we want to make sure that everyone can understand each other. And we'll go ahead and get started. As I mentioned, we have 5 speakers today. We have Zara Rahman, who's the Deputy Director at the Engine Room, and Zara also runs the Responsible Data List, which if you're not part of that list, I encourage you to join up, because there's great discussion that happens on the list around this topic of responsibility and ethics with data. Then we have Sean, who's the co-founder of Digital Public and the CEO of FrontlineSMS, who's got quite a lot of experience around data governance and pretty strong opinions about contact tracing and some of the downstream effects of some of these new suggested technology solutions that are being proposed for the COVID time. Reema Patel comes from the Ada Lovelace Institute, and Ada Lovelace has just put out a really interesting report about the privacy concerns and ethics concerns on some of these new proposed technology solutions for COVID. Then we have Tracey, who is currently independent. She's going to a new job soon, I understand, and she was at DataKind before. Tracey's going to talk a little bit about the use of data and artificial intelligence and some of the challenges with those types of approaches in these times. And then Amanda Makulec is at Excella and also from the Data Visualization Society. And she's going to talk about some of the ways to make sure that you're doing responsible data visualization and not kind of encouraging bad decisions because you have data visualization that is not responsible or not accurate or is not well explained. So having said all that, I'm going to pass over to Zara.
Oh, thank you so much, Linda, and thanks everyone for coming. I know there's a lot of competition right now with online events and webinars, and I hope you're all managing to take care of yourselves. So yeah, I guess I'll just do a brief introduction to a bunch of issues that I hope that we can kind of dive into in more detail on the breakout rooms. These are drawn from lots of discussions on the responsible data list, as well as, things that have been happening around the place. So I'll dive right in. I guess to start off with, one big challenge that I see is this big rush for more new data, almost as a silver bullet to solving this all that's going on. There are obviously a lot of people in leadership positions, a lot of governments really scrambling to know what to do. And many of them are really seeing more data as the answer. I think the big problem with that is that they don't quite know what they need, and they don't quite know what to do with it when they get it. And I guess bigger picture, they don't know what question to ask when they do, try and design or gather data. And I'm sure Sean's going to go into this in more detail, but for example, with contact tracing examples, there's evidence to suggest that using people to do contact tracing has worked, but relatively little to suggest that using kind of data and smartphones will necessarily meet the goals that they're trying to do of reducing kind of the spread of COVID, obviously. There's also a lot more to be said about the kind of privacy implications of those apps that I'm sure Sean will go into in more detail. Secondly, I think there's a big lack of transparency and accountability in public-private partnerships that are being made. As I said, as kind of governments and leadership, people in leadership positions are scrambling for, to know what to do, to know where to go for answers. There are a lot of, it feels like scrutiny is almost at an all-time low instead of actually the opposite, I guess, as it should be, just because of the crisis situation that we're in. And yeah, there've been some really interesting writings about how transparency really needs to be an all-time high, but that for that to happen, it needs people in those positions of leadership to be kind of opening themselves up to that transparency and that accountability. And we've not been seeing that as much of that. So for example, Palantir is partnering with the National Health Service in the UK for the first time. I feel like in a normal situation, that would raise a lot more questions or a lot more attention than it has right now, just because everyone's at capacity and there's so much stuff going on right now. Thirdly, and this is a really big but simple one, is increased surveillance. More data means more surveillance by someone, depending on how the data is being gathered. There have obviously been efforts to do kind of more decentralized approaches that would build in more controls and kind of access controls to that. But also countries that are taking a much more centralized approach, even approaches where intelligence agencies are working directly with the people in public health to build apps or to gather data, which is deeply concerning. There's also more kind of indirect consequences aside from the really kind of obvious ones of people trying to gather data to map or to reduce the spread of COVID, such as many places are moving to more digital payments instead of cash. Generally, a lot more is happening in digital spaces instead of offline. And I guess we'll continue to see the kind of side effects or kind of less direct consequences, but generally it feels like, as we can tell from being in a digital event, there's lots more happening in the digital space. Then I guess just thinking long term, even though that is a little bit tricky right now, the long-term impact of fast moving or really quickly made decisions. So wondering if, new sets of data are being gathered, what will happen to that data after this is over, if it's over in some, depending on what it being over means. In the partnerships, what does that mean for apps that are being built together? What kind of access has been granted now in order to make those things happen, and how will that change afterwards? Generally, it seems clear that there do seem to be kind of multiple purposes of data being gathered, whether that's locations of people or other things that I'm sure intelligence agencies would love to get their hands on, or other kind of, there are other uses. And just there seems to be a really, just like a lack of focus on what the specific purpose is, and a lack of commitment, or lack of commitment that we can hold them to, of what those commitments would be, or what those specific purposes would be. Then one other concern is just an over focus on the end results, or the kind of shiny data visualizations, or the big picture numbers, instead of on the process. And I think we'll hear more about data visualization later in this call. But of course, methods matter just as much as end output. Like how the data is being gathered makes a huge difference to what those numbers look like. And we've seen that with, different countries gathering or collecting and counting, for example, like in the UK, when we've not been collecting the number of people who've been dying in care homes, whereas in Belgium, they've been collecting the number of people who might have died of COVID, but it's not confirmed. So it makes those kind of data sets far harder to compare. And it just requires a lot more attention on process that I think a lot of people just aren't paying attention to right now. There's a really good book, Data Feminism, that was published recently that really goes into some of the kind of power dynamics behind, and what happens, the more behind the scenes aspects of gathering data, that I would really recommend as well. And then I don't know if this is quite the audience for it, but I wonder a lot about all this focus on data. There's a lot of bad leadership decisions that are happening that go directly against evidence that's being gathered. And it makes me wonder whether hard data or more facts and numbers will actually help. Not to say that we shouldn't be trying to gather that, but what is the purpose? Like, what are we trying to do? Are we trying to hold power accountable for those poor decisions, perhaps after the fact or during the fact? Or do we expect that will actually inform what's happening right now? I think, there's been a lot of kind of sociological research into how facts don't change minds or behavior, but it's other things around that. And I think it's important to always put that data in context and not forget about the bigger, the bigger goal of why are we using that data, and how are we trying to use that to inform people. And with that, I guess I'll hand back over to Linda. Thank you for having me.
Thanks, Zara. That was really interesting and super useful. And I love the links and the resources that you shared as well. Folks have shared those in the chat if you're interested in getting links to any of those books, or link to the Responsible Data Forum that the Engine Room runs. I'm going to hand off to Sean.
So I thought I'd start maybe by taking like one step back in thinking through context and just the environment that all of this is happening in. So currently 84 separate countries have declared some form of emergency, or have suspended basic rights in some way. A number of other countries have informally done that, or managed to encourage lockdowns. Essentially, we're also seeing quite a lot of lockdowns start to become a law enforcement issue. And so we're also seeing that a lot of what becomes or starts as medical advice can often become direct physical violence and conflict in some places. And it has already resulted in death in a number of places around the world. So I think that the thing that I really want to focus on here is, and really drawing on Zara's point, is the importance of process and infrastructure and context in the way that we do these things, and in the way that we intervene with tech, and the way that we intervene with data. And one of the really interesting observations I think that we see are the real boundaries of fields here. So much of the commentary is, epidemiologists or computer security experts or statisticians, people who are very good at algorithmic modeling. Some people are very good at, deploying tech during emergencies, and all of these fields need to be talking together right now. And so there are these both real-time translation issues, and that each of these fields has its sort of own approach to making sure that the things that it produces are moral and ethical and fit for purpose and actually good, right? That they're at their core validated approaches to something. And right now, both because those approaches are often very disconnected, and also because the public authorities that would normally be, focusing on scrutiny here are instead repurposed or rededicated and focusing on the response, we have this real set of institutional gaps where we're not seeing the kind of quality control, the kind of due diligence, and the kind of basic oversight, both from an ethical perspective and also from a quality control perspective that you would hope. And this happens quite often during disasters. A few years ago, I got really concerned about this with Frontline, and started looking into this work around Ebola. And essentially, the main problem with Ebola was that proximity was not a very good indicator for transmission. And so when people were talking about using mobile phone data to track proximity and to track contacts, it was a really weak signal indicator. And here we have that same problem, where proximity alone is not a terribly good indicator of transmission. And so a lot of the apps, a lot of the technologies that we're hearing about are sort of trying to reverse engineer the significance of proximity data more than they are necessarily trying to solve an important healthcare system problem. And so, a lot of what we see in these systems or in these approaches are trying to learn new things, trying to solve the unsolved. And so we see a lot of really interesting and valuable experimentation, but I think a lot of the challenges arise out of that experimentation not necessarily having a barrier to market, or being able to move really fluidly from lab to application in the kind of chaos that Zara described. In that chaos, I think one looks to every kind of tool that you can use to try and arrange and secure relationships. And so I think a lot of what we're seeing, in addition to large app deployments and large kind of large conversations about use of data, is this move to figuring out what might accountability look like, both in process, how do we rebuild some of those quality control and ultimately accountability guardrails. And I think that where we'll see a lot of that play out, and one place that I would really encourage this community to look, is in the contracting and in the way that we secure and formalize those relationships, because there really is both a lot of good opportunity there and a lot of very concerning open-ended pieces. And so it's a real opportunity to engage with data rights and responsibility right now in real time, and to both make a positive difference in terms of what kinds of proposals we're considering from technologists and from public health responses, as well as how we might hope architect accountability when we get to whatever end state we get to where those things feel possible. I would just offer that some of you may have read a piece called "Distracted by Data" by Elizabeth Reneris, which is just a really wonderful short piece that I'd recommend. And ultimately, the point is that these are all power relationships. When we're talking about data, we're talking about sharing both the sort of the information and that we all know to be contained in it, but we're also to an extent sharing the social license to act on that data. And that we, as a responsible data community, in the way that we talk about apps and the way that we talk about how we use data, also has an impact on what everybody else sort of thinks is acceptable and is good practice. And so there is this huge amount of opportunity as well to kind of start taking the statements of principle that many of the organizations on this call and in this community have work very hard on, and turning them into the kinds of operational practices that actually have teeth in supply chains and build out some of these data governance frameworks. So just to say that there's a lot of daunting technology out there, but ultimately the power relationships aren't all that complicated, and that there are a lot of ways that we can intervene by both, strategically negotiating and renegotiating some of the terms of those relationships, but also engaging with the communities that are as capacity support for the institutions that are trying to deal with that in real time. So with that, I'll stop.
Great, Sean. Thank you so much. We're going to pass over to Reema now to tell us a little bit about some of the research that Ada Lovelace has just put together on some of these specific apps, and kind of a nice feed in from what Sean was just talking about.
Brilliant. Thank you. So I think I too will also want to take a bit of a step back and articulate some of the reasons for why we published the research and why we did this work. So we recently published a report called Exit Through the App Store, and we were looking at 3 key digital technologies that looked like they were going to be quite important subjects of debate during this time. One was symptom tracking, one was digital contact tracing, the other, which we're having less of a conversation about, but it's really interesting, is immunity certification. And the reason we felt that we wanted to have a look at these technologies is because it became immediately apparent that the conversation wasn't really about technology. The conversation was about the implication for rights and the implication for our society and our democracy should we turn to these technology. And the work that we're doing looks at these issues through the lenses of questions such as purpose limitation. So actually, with the technology, is it clear what the purpose is and actually what the limitations to the purpose is? Is it clear what the data being shared or accessed or controlled is or not? And I think related to that, there's a really important point about mission and scope creep. So the rate of change in many of these technologies means that you could start off with something that had quite relatively decent legitimation, for instance, through people voluntarily accessing it, but could then morph into something that lacked that clear remit or functionality that escalated out of control or had some mission creep associated with the app. So you could start off with something that people voluntarily accessed or downloaded by way of consent, and then end up with something much more problematic, i.e. mandatorily required that you accessed or you have to be part of. And that's before you even get into the issues around accuracy and quality. And then the point that Sean was making very well, I thought, which was the issues about the app. So even addressing the problem or the challenge. So in a public health crisis, if one deploys technology just without really thinking about whether it's actually going to address the nature of a challenge, it feels that we've not really had a societal debate or a societal conversation about why a particular app has been deployed, other than the point that the app had just been introduced as a kind of knee-jerk, panic-induced reaction. Zara mentioned this wider point, which kind of draws upon some of the other research that we've been doing, which is the Foundation of Fairness for Health Data sharing, particularly when private sector organisations are involved. And it's Palantir and the NHS example is a really good example of when there's a real risk of power asymmetry being exacerbated, being worsened, that already exists between the private sector and the public sector, so in this case, the NHS. Because the NHS is incredibly overstretched, particularly at this time. So we're pretty concerned about that, and we ran some citizen juries in order to support the government to understand a bit better what public privacy concerns were about that. Off the back of that research report, which was published before we went into lockdown, we called on the UK government to be much more transparent about the nature of these partnerships, to enable public engagement and participation to happen on the nature of these partnerships. And we also called on the government to tighten up its auditing and its scrutiny of these partnerships. And these are concerns we still have, and we think that what's happened at this moment in time with initiatives such as Palantir and the NHS illustrate an ongoing problem there. I think there's a few aspects around digital contact tracing in particular that's challenging. So one is that many states, nation states have been requiring mandatory use of contact tracing, and also there are very particular ramifications for nudging and behaviour control. So this is where we get out of the remit of we want to use data in order to understand the scale of a crisis, or to understand essentially to conduct surveillance for understanding the nature of the disease, towards surveillance that is about shaping people's individuals' behaviour. And I think this speaks to a wider societal question, which is what is the implication for COVID-19 in terms of the types of democracy we want to create and build, and how should governments legitimately behave and through technology often as a mediating source in relation to people. Should government be thinking about using technology to shape the way people behave? One thing that we call for through the report was the points that immunity certification lacks an evidence base for its introduction for various reasons, but we did identify through the rapid review of evidence that there was very limited evidence and almost none evidence that illustrated that either digital contact tracing or immunity certification actually worked. And the WHO have actually put out an official policy position that confirmed that immunity certification in particular doesn't clearly work, because it's not clear that if you are identified as being immune that you wouldn't, be immune later on. So one could end up being certified as immune and then have some real problems and recontract the disease later on down the line. And so this goes back to this question, which is the technology being introduced, or the technological development being introduced for the right reasons or the right purposes, or are there other pressures and conditions in the wider social political landscape that are shaping government's consideration of the decision? So, I mean, I think in a nutshell, the questions about privacy and the questions about data ethics are less about data ethics and more about the types of society we want to build. And the conversations that we're having about symptom tracking, digital contact tracing, and immunity certifications are actually about what we understand in the evidence base and what we choose to make our decisions on. Are we making our decisions on the evidence base, or are we actually making our decisions under a pressure cooker climate, in a pressure cooker climate, under political pressure? So, I mean, if anyone wants to see the more precise recommendations we've made around the technology, then go to our website and have a look at the app. But I think that ultimately that's the crux of the issue and the matter. Thank you.
Thank you, Reema. Yeah, it's always that it's not only, it's never only just the technology. It's always all of these issues of power and all these different imbalances. And so I appreciate that take on it. We're going to hand off over to Tracey. Tracey, over to you.
Great. Thank you, Linda and Ali, for the invitation to speak today and share the platform with so many people in the civil society space that I admire. There's just so much to discuss about how to uphold data ethics and privacy during COVID-19 times. But today, I just want to focus on the fundamentals. So I'm following the theme of what Sean and everyone else has said. So maybe that is a theme about needing to reflect and step back and think about fundamentals. So I'm going to carry that on. I'm going to look at discuss two things really. First being that strange thing how sometimes we seem to overlook what the problem is. So let's talk a little bit about that. And secondly, the need to collect data to kind of fully understand whether what we're proposing to do is actually working. So the importance of monitoring and evaluation within the tech space. So I guess first off, what is the problem? Frequently in the data science and AI world, and that's one I've come from after recently leaving DataKind UK, is that I often hear about the technological product and our service without hearing the clear definition of the problem the service is trying to fix. So it's just a classic tech solutionism. And this is my main contention, is that if we don't fully understand the problem and the key stakeholders that it affects, then any proposed solution is bound to fail and can increase harm to stakeholders who are not in positions of power and influence. Now, this shouldn't be controversial, and I'm sure you would agree it's common sense, but the allure of data science and AI can be intoxicating, especially from some social organizations who want to appear to be innovative and the associated innovation funding pots. It really challenges organizations to reflect upon their values and to weigh up their integrity versus sustainability. So how should we go about defining the problem? Well, you know, we do have to consult, we need to do thorough research. We know this is happening, and Sean's already discussed some of the issues as well about how different sectors and have different kind of ways of speaking. So there's definitely more that we need to learn, perhaps from the design sector and from community leaders about how bringing disparate groups together. One thing that I've seen, and I'm very sort of irritated about, is in the UK, we have the government that continually states that they are following the science, as if science is entirely neutral and devoid of human assumptions and choices. It does provide a useful narrative, I grant you that. We can avoid lots of the gnarly ethical decisions by blaming this neutral science, but pandemics and catastrophes are inherently gnarly. Choices have to be made within a world of imperfect knowledge. It's why transparency and accountability is so key. And I really welcome all the civil society actors that are here today and who are continually and consistently working to explain and clarify the problems we are facing and are pushing for stronger tech and data governance. This, I think, would reduce some of the potency that some of these technology products have. For example, the recent story of Clearview AI being in talks with federal and state agencies in the US to track COVID-19 using facial recognition. I mean, like, what problem does this really solve? It has massive issues of efficacy, not to mention privacy, transparency, accountability. It's not a realistic solution within the pandemic we face. We need our COVID-19 responses to be open, fair, and transparent. This not only helps society to hold organizations to account, but it also fosters trust. And this also applies to charity funders. For example, a recent but small-scale study has estimated that due to COVID-19, 9 out of 10 Black, Asian, and ethnic minority-led charities in the UK are in danger of closing within 3 months. Now, by publishing opening data on grant funding, we should be able to assess the flow of funding to the charity sector and identify where gaps are. And the Charity 360 Giving in the UK that advocates for this data has supported funders to tag their grants data with COVID-19, and some charity funders are using it as a basis to form collaborations. So in focusing on the problem, we need to discuss what the potential consequences will be for everyone, especially the most marginalized in our society, and use this information when deciding on the various actions we should take. Now, this virus has been said by many to be a great equalizer, and whilst it certainly can affect anyone, we must recognize that it will affect some people more than others. Opportunities to live healthy lives are not equally distributed. We know poorer communities experience worse health outcomes than affluent ones. And I'm not surprised that early data from the UK and US suggests disproportionate negative effects of COVID-19 on ethnic minorities who are largely in low-paid jobs, providing essential services, and face structural inequalities. And of course, we cannot ignore the impact on women, who make up a disproportionate amount of the health and social care workforce, who are required to care for the public, often shoulder the core care responsibilities at home and in the community, and carry the frustrations of male partners indicated by the increase in domestic violence incidents. And we must not neglect that all these various demographic classifications aren't necessarily independent. So if we don't center the social determinants of health and the groups who are likely to be impacted the most, I fear that our technological solutions will increase inequality. So this isn't easy. I'm not saying it is. I've laid out a lot of problems. But those who are at the front of this battle, they may well be so stretched that they may lack the capacity and the state of mental health to take up the invitation to discuss the implications of various technologies. But this shouldn't be an excuse not to ask, nor for us to suggest ways for how they can be included. Inclusion must stretch across the whole tech development pipeline, and we must collect, monitor, and analyze demographic data, so gender, ethnicity, disability, but this has to be done under strict codes of data management and governance. Because if we're not collecting this data, both qualitative and quantitative, we will not understand how these groups are faring with COVID-19. We won't know if interventions are ethically just. And I mean that in terms of that the benefits and risks of the solution are distributed fairly. And while this again seems to be common sense, throughout my career, I've been frustrated by culture and politics. So I'm going to take an example from the UK sector, who due to COVID-19, so not the UK sector, the legal sector, who due to COVID-19 are ramping up their already planned digital services. And this includes moving in-person court hearings to remote court hearings. Now, the Equalities and Human Rights Commission has examined this, and in their recent interim report found that video hearings can significantly impede communication and understanding for disabled people with certain impairments, such as learning disabilities, autism spectrum disorders, and mental health conditions. And it's expressed concern on the lack of data currently available and is encouraging government to begin data collection. So the movement to digital may be affecting disabled people's human rights for access to justice. And while there is a public sector equality duty, which requires public sector to advance equality and eliminate discrimination, the need for the collection of demographic data by courts is a battle still to be won. So I know the Director of Research of the Legal Education Foundation, Natalie Byram, is on this call. So it's great if you want to find out more to have a chat with her after. Now, due to the time, I'm just going to throw out other sort of advice and questions that I have that I think is pertinent, and we can take this out to the breakout rooms. So how are we going to include the range of stakeholders that we need in this problem definition and throughout the technology product service development and implementation? I know that Reema has already mentioned her work on citizens' juries, and there's others on this call that's going to have some great ideas about this. So I'd say as a minimum, we must value people's time to contribute. Now is not the time to be extractive without compensation, and nor to place the burden on communities to continually advocate for inclusion. So I'm actually heartened to see a recent paper from computer and data scientists at Google and DeepMind, which explores how data scientists can involve communities at the problem definition stage. I think that's a great move from the data science community. We should not be afraid to press the pause rewind button on the use of big data and AI. Just going to say that, full stop. We should take ideas and learn from the mistakes of previous pandemics and natural catastrophes and not be bamboozled by whizzy tech. And Sean has done lots of great work on this already. If we are pressing go on a data science AI project, understand the data and social context. Where is it from? What is history? Who stands to win and lose? Do your research. Look at who's building it. Monocultural teams with the best intentions are going to miss something. So development teams need to be diverse, and they shouldn't only be comprised of technologists. And then finally, to end, if COVID-19 is an opportunity to make societal changes, as some leaders are suggesting, and we are seeing some policies that were said to be impossible being made possible, then we all need to raise our voices and actively work towards social, economic, and environmental justice. Thank you.
That was a lot, Tracey. It's so useful. I think you really hit on the heart of a lot of the challenges before us, but all of the really critical things that I think people in this community and outside of this community need to be thinking about, and a lot of the work that civil society has in terms of advocating for these issues of inclusion and justice. So thank you so much for that. So we're going to hand right off over to Amanda to talk a little bit more about responsible data visualization.
Thanks, Linda. I am Amanda Makulec. Excited to be here today and dig into perhaps the piece of COVID-19 and the story that you've probably seen and heard the most about in the news in some ways, because there's this saturation of charts and graphs and dashboards and other information being presented visually. And the reason for that, as I think most of us probably know, is because of the ways that data visualization makes information sticky, and it helps people kind of understand and look at and make sense of data and information. But I want to point today to a couple of the challenges, concerns, and constraints we face around visualizing data for COVID-19, around both being better visualizers of that data for those of you who are analysts who are on this call, but also as better readers and consumers of that information as we figure out what we share and how we demand more in terms of visualizing the uncertainty in what we know. So first, I want to tackle what are our biggest challenges that we've seen visualizing COVID case data and death data, and focusing specifically on that data since it's a core crux of a lot of the models that are being built, trying to somehow create this crystal ball into the future of what could or would happen in different states or countries, and help policymakers make sense of when they should reopen economies and try to weigh the differences between what the implication might be of reopening this week versus next month. So a couple big constraints and challenges we've had. I just want to point to that saturation piece. There are so many charts and graphs about COVID-19 that are in the news right now. And I've heard from journalists that part of it is because of just the draw that this topic has. It is a global challenge and a global crisis. As we look to different outlets like the Financial Times, for example, or the Washington Post, their most viewed pages of all time on their websites are their graphs and charts related to COVID-19. And for the Washington Post, that's specifically the animated explainer of the flatten the curve graphic that Harry Stevens did. So these visualizations certainly have wide reach, but we kind of reach a saturation point where I have to ask, how relevant is this data or information to me? And how is it helping me in my day-to-day decision-making or with my own mental health? So I would say, as we dive into this conversation, if you've seen too many charts and graphs and are sick of looking at log scales, it's okay to step away and decide what data serves you. We have the challenge that a lot of data is incomplete. So that data that we get about the cases, as we know, is a function of how many tests are being done. And some of our previous conversations in this talk today have really focused on some of the gaps and challenges we have in the data. The issue with the fact that we don't always have good disaggregated data, and the challenges that we face when we have both known unknowns. When you look at a table of information on different cases in the US, for example, from the CDC, and you can see that a number of cases don't have data on hospitalization or on race that are actually recorded in the current data that's being reported out. So there are known unknowns, which we should demand that we see and understand so we can see what the denominators are in some of these charts and graphs that are being presented. But there's also all of the unknown unknowns. We can't do a really firm estimate of how many cases there are or infected persons there are that haven't been confirmed with a test for various reasons. We have to think about all of that uncertainty. That uncertainty is a really important piece, and it's something we see in the models. And the better models, I think, try to go ahead and visualize that uncertainty as best they can. Other models try to plot these very firm fixed lines when really they're kind of a best guess or estimate. As you look at models and look at visualizations, look for people who are transparent about the uncertainty in the information and the limitations of what they've created. And if you're really curious about some of the details on how we visualize and see or don't see uncertainty in data, there's a great recorded webinar from Matthew Kay and Jessica Holman at Northwestern, all about visualizing uncertainty around COVID-19 that relies on a lot of their in-depth detailed user research on how we see and understand uncertainty in something that ultimately is meant to help us enable understanding and show some certainty in the data. We believe data that is on charts and graphs. We have the challenge that a lot of reporting and percentages and calculations are more complex than they might seem at the surface. Just because you can divide, say, the number of deaths by the number of cases doesn't mean you're calculating an accurate case fatality rate. That's been the case, especially early on in the epidemic when there were very small samples of people who we actually had data on. And so I really think we need to look to epidemiologists and other experts who can build those kind of models and make those estimations. Just because a tool like Tableau or a tool like Power BI lets you run that mathematical function or calculation doesn't mean that the number you're pulling out is accurate or correct. But when we start to plot those numbers, as we've seen in some of the widely circulated charts and graphs, suddenly those seem more certain. They seem more like numbers that we know rather than calculations we've kind of run based on the best data we have and not really knowing all the nuances of that. And I've done a couple interviews with epidemiologists and others going ahead and talking about that uncertainty and those challenges, and really wanting to look to them as experts. I think that we also finally need to not forget the humanity behind this data. I think that in some ways, the bigger the numbers grow, the less they seem like people and like stories. And as we think about responsible data visualization, I think it's important to remember that whether we're looking at a chart of cases and deaths, or we're looking at a chart around unemployment, each of those individual data points on that chart is a person. And I think we sometimes forget that as we're creating these aggregate charts and graphs, and really need to return to some of those principles from Georgia Lupi's Data Humanism Manifesto, and thinking about the ways in which data is represented and represented as people. For me, seeing some of the pictures of the lines of the cars outside of food banks waiting for support in the US, juxtaposed against piles of potatoes that were being thrown away in Idaho because there wasn't the supply chain or the demand to get them out to places who could buy them. That to me just tells a starker story of what's happening here in the US in this current environment than any chart or graph could. And so as we think about the data, I think we need to think about this data humanism. As we think about this, I think it's good to also make sure we're anchored in who is involved. There are data collectors, there are analysts and visualizers, journalists, there are other translators of information, and there are readers. And I think that the burden and the responsibility is greater on us as visualizers who present and share information, and on journalists who are then taking that information and making it accessible to the public. Some intersection there on data journalism in some ways. The burden is greater and the responsibility is greater that we communicate these things well, because the unintended, or perhaps intentional in some cases, consequences of us making misguided comparisons or presenting incorrect stories is much greater. If the chart I create makes you think that this COVID-19 situation just is another flu, that's problematic, because it could cause you to not take some of the basic precautions around wearing a mask in public to protect other people and essential workers, or doing social distancing. So as we think about that responsibility and where that sits and where we bear that, I think it's important that we think about the things we can do, both as analysts and tech folks, as well as readers of data visualizations. One is we can demand and look for more honesty about the uncertainty in the numbers. I remember seeing an NPR chart that in the footnote, it said that there were 6,600 cases represented in the disaggregated data. But I knew at that point in time, we'd had over 120,000 cases in the US. And going back to the data source from the CDC, it was clear that the story not represented in that bar chart was really a story about the unknowns in that data. Always consider the people behind the data, like we talked about. Think about the stories there. Bring those voices to the table. Bring a patient voice to the table as you're visualizing and sharing information. Think about how someone would feel if they lost someone to COVID-19 and we're looking at your chart and graph. Think about the people represented there. Collaborate with those subject matter experts, epidemiologists and others, and vet your work before publishing. Look and see if your colleague, or maybe it's your roommate or your spouse sitting at home with you, can take a look at your chart and graph and say, hey, I think I see it this way. And that might not be what you intended. And then finally, if you're actually going ahead and doing data visualization, if I could close with these words, please think before you publish into the public space, especially around case and death data. There's so much uncertainty and nuance in that information, even if it's data that seems staggeringly available through all of the virtual spaces, the AWS data lake, the Tableau data repository, the JHU GitHub. You can grab that data and do things with it. But the big question on a responsibility and ethical side for me is, should we? Should we use it for our own exploratory data analysis, or should we be publishing in the public domain because it's actually helping to enable understanding for others? So think before you publish, and feel free to play with that data on your own, but consider how someone else might see it if they look to you as an authority in the data space. And then finally, look for other data to visualize. Think about the other things happening in our world right now. The story isn't just about cases. The story is about all the other things that we're seeing. And think about where we can divert our attention to raise and elevate those kind of stories and look at that data. So I think I've given a lot to think about, hopefully, as we go ahead and shift over into breakout rooms around the data we're consuming every day. Linda, back over to you.
Thanks so much, Amanda, and thanks to everybody for these amazing points. I think there's going to be quite a lot to discuss in the breakout rooms.